changes in R are mainly caused by changes in school age mixing. So then the researchers found that for all open school scenarios, contact is most common between individuals of the same or similar ages, and there was a greater contact between children and adults between ages 25 and 55, which reflect the contact between children and their parents. And on the other hand, the analysis showed increased R values as more year groups returned to school at the same time, and among the year groups, secondary school students caused highest increase in R when they returned to school. And interestingly, none of the scenarios raised R above 1. So now I have the author's interpretations of graphs of different scenarios on contact pattern and secondary infection. And I could briefly just mention a few to save time for other presenters. So first, researchers examined the control scenarios where schools were still closed, but one has strict lockdown, while the other scenario had weaker regulations. So under the strict school closure, which is on the left, secondary infection occurring is quote unquote extremely low. And as expected for the weaker school closure on the right, there is a slight increase in the risk of secondary infection occurring. However, both cases result in R values significantly below 1. And for the scenario where all primary schools open, the R remains below 1, but increased from the previous scenario, so it's 0.82. And for all secondary scenario, the overall value is 0.9, which suggests that secondary schools represent a higher risk of increased transmission potential than primary schools, which had an overall value of, I think it was 0.82. And lastly, when all schools reopen, the R value reaches 0.96, which is still smaller than the limit of 1. But as I mentioned earlier, all of these models assume that the interaction of the entire community has not changed, which is highly unlikely in real life. And next, we can look at the impact of different school opening strategies on R by regions in England. So let me just find that. So the first 3 graphs here, in these first 3 graphs, all 8 different scenarios are not close to reaching the red lines, maybe except for this one. And the red line is the absolute increases required to raise the reproduction number to above 1. But then in the last graph representing Midland, opening all schools is super close to meeting the red line, and the 95% prediction intervals exceed the threshold, suggesting that a high chance of resurgence can occur if all schools open in this region. So lastly, we can look at the impact of different school opening strategies on clinical cases in England. And I have organized the graphs into 3 sections where the first is on increase in number of cases, and the second is on the increase in ICU admissions, and lastly on the increase in deaths. And since the graphs in all 3 sections have similar trends, I will just talk about one of them. So in this graph, under different school opening scenarios, the graph on the left shows results of school reopening in various ways without considering the reproduction number of the community. And the red bars, and the red bars represent increases in ICU admissions when the reproduction number is low, while the purple bars represent increases in ICU admissions when the reproduction number is high. And the increases were relative to if no schools returned. And you could see again that there's a trend that older group of people returning to school generally resulted in larger increases in ICU admissions. So now the graph on the right shows increases in ICU admissions due to reproduction numbers from opening schools in various ways, which is indicated by darker colors, as well as from the lockdown relaxations in the community, and that is shown by the lighter color. And you could see that the lighter colored bars are significantly larger than the darker colored bars. And so we could conclude that the high relaxation of lockdown measures in the community leads to greater increases in clinical cases, ICU admissions, and deaths, exacerbating the impact of school reopening in all 8 cases, and especially worse when all schools open. So then I want to mention some of the limitations that this experiment had, of course, as we are using mathematical models and parameters. So the researchers were incorporating, the researchers could not account for the probability of the general population to change their behavior even during a strict lockdown, and mainly consider interactions students would have at school only, meaning that they did not include other interactions like parents interacting at school gates, teachers exposure while traveling to school, and all children mixing outside of school. And in conclusion, a communal effort is much needed to successfully reopen schools. And the authors believe that reopening schools is not the primary driver of SARS-CoV-2 transmission, but that the behavior of the general population can significantly impact the transmission of the virus and the clinical cases once school reopens. And that's it for me. Thank you.
Okay, if no one has any questions for Yeji, then I'll start mine. Before I begin, can someone just verbally let me know if they can hear me?
Yep, you're good, Hope.
Thank you. Okay, so my name is Hope, and I major in biology and public health at Santa Clara University. Today, I'll be talking about an article titled "The Closure of Schools During an Influenza Pandemic," and it's a review article published in 2009 from the Lancet Infectious Diseases. So I summarize some important takeaways of school closures from past influenza pandemics that we can apply to the discussion around reopening schools in 2020. And to just show some examples of past school closures and their impacts on the influenza outbreaks. In Hong Kong, schools closed for 2 weeks right after the peak, and a reduction in cases was seen, but that was because there's going to be a reduction in cases anyway right after a peak. So the researchers found no significant effect of school closures on the number of cases. For the teacher strike in Israel in 2000, the researchers looked at cases 2 weeks before the strike and the 2 weeks of the strike, and significant reduction in cases was seen during the strike when schools closed, but there was a rebound in cases when students returned as expected. Looking at the school closure in France during the 1957 pandemic, school closure was delayed till about 50 to 75% of students became ill. Schools were reluctant to close because of a lack of national policy on school closure, and the schools were essentially closed too late to be effective in reducing cases. Lastly, looking at the 1918 influenza pandemic in US cities, many of the same interventions we are using now to prevent the spread of coronavirus, such as school closure, banning mass gatherings, case isolation, requiring masks, were used, but the type and timing of these interventions was different across cities. So it was found that the interventions that were prolonged and implemented early resulted in positive health benefits. So next, we will look at the downsides of school closures. Clearly, from parents who have to stay home to support their kids during school closures, that's going to be a high economic cost for our country. There's also effects on child hunger, like Samantha mentioned earlier, from students not being able to receive the lunches or breakfasts they may receive at school for free. There's also more children left to self-care, which is children being left at home on their own, and that's associated with increased underage drinking, drug use, and adverse peer pressure. Some studies have also concluded that parents will overestimate their child's ability to self-care. Some socioeconomic factors to consider are that children from low-income families are more likely to be left alone and will suffer from more behavioral and social problems. As a result, studies show that declines in performance in education after summer break are greater for children from low-income and minority groups, and this will likely not be different for school closures due to a pandemic. It was found that 93% of 91 low-income households would have serious financial problems if they had to stay home during a 3-month school closure. Lastly, looking at school closure effects on the healthcare workforce, the benefits of school closure need to be weighed against the detriments of absent workers from the healthcare system who may have to stay home to take care of their children instead of going to work. And then we will look at important aspects to consider that the article mentions for reopening schools during a pandemic. As we all know, the impacts of lessened social distancing, the positive effects of social distancing stop when they're lifted. And just an example, a second peak was seen in many US cities during the 1918 influenza pandemic when social distancing measures were lifted. The criteria for reopening schools that the authors recommend are that lifting of social distancing measures requires some assurance that herd immunity has been reached, either through immunization or natural infection. The author believes cross-sectional seroprevalence surveys are the best way to determine the level of population immunity, or they suggest a guideline to be reopen schools only when children have been immunized. And in reopening schools, there also must be a plan for when to close schools, and it's important to note that there can be difficulties in creating consistent national policy. And the example of the 1957 school closure in France that was based on local decisions rather than a synchronized national decision demonstrated how unorganized school closure had no significant effect on the reduction of cases. Lastly, it's important to consider the age-specific transmission rate of the virus. Different viruses have different attack rates among age groups. Because most of the transmission of the 1957 influenza example in France occurred among children, school closure would have been an effective policy. However, school closure would have had a less significant effect in 1968 when the attack rates were similar among children and adults. So the costly strategy of school closure should be based on age-specific estimates of severity and morbidity in cases of the virus. And that is all for my presentation. Does anyone have any questions or comments? Okay, thank you. I'll hand it off to the next presenter.
Thanks, Hope. I think our last presenter then is Ashley, and then maybe we can do some global comments sort of about what we think about the evidence that as presented and, you know, whether we think schools should reopen or not. Everybody can kind of take a vote.
Okay, so mine is the case study in Israel. So let me see here. Okay. Sorry, hopefully you guys can all see my screen. So Israel declared complete closure of educational facilities on March 13th as a control measure for SARS-CoV-2 transmission. Limited reopening was permitted after May 3rd for kindergartens and grades 1 through 3, and then 11 through 12. And then all schools were reopened a couple weeks later with the public health requirements, including daily health reports, good hygiene practices, face mask usage, social distancing, and minimal interaction. The first COVID-19 school outbreak emerged in a high school on May 26th, resulting in at least 130 cases among students and staff. The spike in cases in Israel following school reopening has also been observed in South Korea and France. So this is the study. Okay. So the first case in the public school was identified on May 26th, and the second was on May 27th. The two cases were not found to be epidemiologically linked, and further testing of all students and staff found that 153 students with an attack rate of 13.2% and 25 staff with an attack rate of 16.6% tested positive for COVID-19. The outbreak at the single school has been associated with a total of 265 COVID-19 cases, including students, staff, and then also friends and relatives who were their contacts. Okay, so just some general information about the outbreak. The school contains 1,190 students aged 12 to 18, so that would be grades 7 through 12, and 162 staff members. This school reopened on Monday, May 18th, after being closed for about 2 months. And then from May 19th to May 21, face masks weren't required due to an extreme heat wave. The first 2 individuals to test positive had attended school all of those days in that period, and they also reported mild symptoms. And following the 2 first cases, the district declared an outbreak. They closed the school and then they tested all staff and students for COVID-19 over the weekend. All right, so 66 out of the 153, or about 43% of student cases, and 19 out of the 25, or 76% of the staff, reported symptoms for COVID-19. Leading symptoms were cough, headache, fever, sore throat, and myalgia. There was 1 emergency room visit, no hospitalizations. Although classes were supposed to maintain social distancing, a school inspection reported crowded classes, allowing only 1.1 to 1.3 meters squared per student. As of June 30th, 100 of the student cases, which is 65.4%, and 16 or 64% of the staff have recovered. And then that was defined as having 2 negative PCR tests. Additionally, 60% of asymptomatic cases and 37% of symptomatic cases recovered within the 25 days. So then this is their table 1, which shows the breakdown by grade, all students, and then staff. And then so they have the number of people in general at the school, the number of people tested. And then they also looked at male breakdown, which, as you can see, was slightly overrepresented among the students. Then they have the confirmed cases, males confirmed cases, median age, and symptoms. Oops, sorry. Okay, so then here's the figure 1 with the results of the COVID testing and the school outbreak in Jerusalem. So where the light blue is the negative COVID tests and the darker blue are the positive. They go in order of grade sequence, and I can see a little bit here. So where we have 7th grade on the left going up to 12th grade, and then we have the school staff as well. And just a couple of stats regarding this figure. Let me see if I can pull both of them up. Okay, so overall the rates were highest among the younger students. So you can see the 3 youngest grades had the highest COVID positives. And so that was grades 7 through 9 compared to the older grades 10 through 12. Rates peaked in the 9th grade with 20 cases in one class alone, and then 13 in 2 others. And 7th grade with 14 cases in one class. 7 of the 25 teacher cases were exposed to these 4 classes. So 4 of the teachers taught all of them, 2 taught 3, and 1 taught 2. And additionally, the 7th through 9th graders had classes in a separate wing than the 10 through 12, but they shared the schoolyard and the public spaces. Okay, so this specific outbreak resulted in an additional 87 of those confirmed contacts among the students and the staff. So making again that total of 265 cases. This outbreak resulted in age distribution analysis before and after the school's opening. The analysis found school children 10 to 19 years old composed about 20% of cases during those initial weeks before school opening, which was 9 through 21. And then it increased to about 41% in weeks 22 through 25. So then we have just a visual representation of the analysis, where again, schools were opened on the 18th. So then we saw the initial uptake from actually this school study, and then additional schools as well, where this light, I can zoom in a little bit more, but this light kind of pinkish purplish color is school-age children. So you can see how the breakdown changes a little bit from before when the schools were closed and then when they're open. And then figure 3 shows the age distribution in Jerusalem compared to the rest of the country, where Jerusalem is that kind of turquoise color, and then the rest of the country is the green. So again, showing the prominence of school-age children in Jerusalem in comparison with the rest of the country. And for those who can't see it, this row right here, this row right here is the school-age children. And then so looking at their conclusions. So the study authors highlight the need for intentional planning of COVID-19 prevention for the school year. They reference various COVID-19 prevention strategies for schools to effectively and safely reopen, including a lot of those public health prevention methods such as face mask usage, hand hygiene, and physical distance that people were already practicing. Studying in small classes, avoiding school if feeling ill, learning from home or having outside classes if possible, considerations for closed spaces with poor ventilation, identification of students and teachers as close contacts, and then considerations for bus transportation, extracurricular activities. So that's the end of what I have. Does anyone have any questions? Okay, so then I can stop sharing.
All right, well, thanks everybody for some great summaries of some pretty complicated articles. I don't know about you, but it doesn't make me any more anxious to get schools open.
No, definitely not.
The Israel study in particular, I think, is concerning. but even if you think back to like the Kaushima's review article of influenza pandemic school closures and sort of the criteria for opening schools up again, it doesn't seem like we're there yet. So hopefully we can get better, or maybe think about a more localized approach to this. Peter and Kat, you guys suggested this topic. So what kind of thoughts do you have after hearing those summaries?
Not feeling super hopeful for one. I also saw in the New York Times this morning, I think it was a modeling group based out of UT Austin, I want to say. They made a nice map that was showing like the risk of students becoming infected based on community transmission. And then it also varied by school size. So they had like a pot of 10 and then a school of 100 and then 500 and then 1,000. And that, if I did feel hopeful, that made me feel less hopeful this morning.
Yeah. I haven't been feeling very hopeful about school opening at all. But yeah, I think that's right, Kat, that I feel less hopeful now than I did when this started. Yeah, Catherine, that's a great point, that reopening schools is a want. I think it's not just a want. There's a real need to open schools. But the question is, safety versus sort of the other needs, I guess, and the safety, I think, is something that's being put on the back burner a little bit.
I haven't seen much in the U.S. in terms of what we talked about last week or 2 weeks ago now, with maybe like the more age stratified or school stratified openings, where elementary schools would open, but upper middle and high schools would remain closed. And I don't know if I've just seen as much of that like talked about in Michigan, much less in other parts of the country.
Yeah, I haven't heard about it much here.
Because it just seemed like such a reasonable option, given, because I think kids really do need to go back to school for their own mental educational reasons, as much as the economic reasons of like sending parents back to work if they can go back to work, or take some of the burden off of them, and hopefully allow like childcare costs. I don't know.
Yeah, I mean, I think that's all right, Peter. I think I haven't heard much in the way of that either in the US, that sort of risk stratified model. But what do you make of the viral load study that just came out showing that young kids have high viral loads? I think was it the 5 to 9 year olds that had extremely high viral loads?
Yeah, I saw that.
Yeah.
It sort of puts a wrench.
I wouldn't jump on something like that.
I know it was small, and
Small studies, how
there's selection
problems in
bias
standardizing viral load estimations.
Sure, and it was CT, not they weren't quantifying virus, right?
Right, so is viral load, even at that point, is it directly correlated with your transmissibility too?
There's that, and then I think also, the issue of only picking symptomatic kids, right? We know that those are not going to be representative of infections writ large. So these might be the sickest of the sick kids.
Right.
Having a viral load.
The situation is, how different are schools with older teenagers, especially, from what's going on in the general population of general teenagers. And the outbreak in Israel occurred before we began to realize how frequent infection is in that age group and in young adults.
Yeah.
And I think they continue to keep schools open. I think it's summer vacation in Israel now. But what's been driving, and they've had a big spike, and what's been driving the epidemic there is the same thing that's driving it every place where it's gone up, young adults.
Yeah.
And they're finally closing bars and restaurants, which were supposed to be following distancing rules, but apparently weren't getting policed enough. And the question is, how much do school openings drive epidemics? And how well is it possible to follow what goes on in schools more easily than what goes on among the same age group who are not in school, if they're out?
Now that's an interesting thing. I mean, I think contact tracing becomes a lot easier at school.
Yeah, it does. The key thing is exposure of high-risk individuals in the schools, such as older teachers, et cetera, because I think some of these introductions occur not from the kids themselves, but from others. And certainly the staff, the teachers and the other staff take it home with them.
Well, and I think the other thing is multi-generational households, which
then goes into multi-generational households. So paradox is just in those areas where you need the schools to be open because of school lunches and all the rest. That's where you also have more multi-generational households. So it becomes a real dilemma.
Yeah.
And I think if this continues to go as long as we are beginning to think it may be going, we are really going to be forced to do some partial school openings.
Yeah, and then I hope.
The question is how to do that.
A data-informed partial school
Yeah.
opening where you're bringing in the kids that are at high risk of some of these extremely negative outcomes and making everybody else stay home or something. I don't know. I mean, there's different ways to look at it,
but I think one of the problems we have in terms of global national policy is we need to get realistic about what can be done in schools when they open to protect the children, because the big worry was, the young children, they won't wear masks, they won't do what they're supposed to do, and that's really of concern. What's turned out is the younger children do follow orders better, and they're a bit less susceptible, and that's not where the problems have happened. They've happened in the teenagers.
Yeah.
Yeah, I think that's kind of back to Peter's point about like the benefits of mental health and socializing. I think those are very valid and very important and necessary. But yeah, it was interesting because earlier in the pandemic, I think there was a study in Germany that was like, of course, high school kids will go back because they're responsible and they can wash their hands. And now the group that is doing the exact opposite when they very much.
It's the exact opposite.
Yeah.
And I know, talking to somebody whose kids who was very concerned in Israel when the schools were opening, because he was concerned that his kid, should he send his kids back to school? And I heard from him exactly the observation about the young kids are the ones that are doing what the teachers tell them to do. It's the teenagers that aren't. And I think that's universal.
Teenagers.
The question is, what is the harm that's being done if we do have school outbreaks?
Well, the one modeling study that we talked about today showed that it could drive community level transmission.
Well, I don't know that I think the other things are also happening at the same time.
Sure. I mean, it's always going to be difficult to isolate.
Yeah, it's very difficult because of the tracing issue. And it probably the outbreak in Jerusalem was an elite public school.
Yeah.
Which meant it attracted a lot of attention.
Sure. All
I have
right.
a
Well,
general question.
yeah, shoot, Ashley.
Is there a lot of conversation, I'm just thinking even on today's articles and everything, is there a lot of conversation regarding what happens when a professor, when teachers get sick?
I can maybe weigh in a little bit from a union standpoint. There has been little discussion about that, if any. And so I'm sorry, to give people context, I'm part of the Graduate Employees Organization, which covers graduate student instructors here at Michigan, but just like local teacher friends who teach at like K through 12 institutions. I don't know the name of the parent union, but a friend forwarded me an email that was from the president of their union being like, hey, sorry, try contacting Governor Whitmer yourself, because like we can't do anything else anymore. So I don't think their input has been really considered, and I haven't seen a lot of like, oh, here's what happens if, you know, this substitute teacher tested positive in this district, but then they taught the next day in the other district and so on. So yeah, that's a really interesting and concerning point, Ashley.
I think that issue may be the one that is most likely to keep schools from fully opening.
Yeah, definitely.
Especially if teachers are asked to sign waivers or something like that, which they won't do or shouldn't do.
Yeah, I was gonna say, which they shouldn't do if anyone is a teacher.
I mean, that's gonna, because there is gonna be an issue of legal responsibility and stuff like that.
Right.
It's been rumored that students are going to be asked to sign waivers as well. I'm curious to see how long, especially Michigan, stays open when professors and students refuse to sign papers like that.
Right. And your like right to an education is guaranteed by you paying your tuition, not signing a death waiver, basically. So yeah, it'll be very interesting. I also do not recommend any students signing waivers.
All right, everyone. I've gotta jump off to another call. So
No, I'm in the.
so have a good weekend, and we'll come up with a topic for next week and send it around as soon as we can. Thanks, everyone. Bye.
Bye. Have a good weekend.